we do have a expert today for this session, that is Dr. Sindhura ma'am, a dermatologist with deep expertise in hair, scalp, pediatric dermatologist and aesthetic treatment. She holds an MD from PGIMR, Chandigarh, and MBBS from Osramia Medical College, and has worked with the Star Hospital, Care Hospital, and ISCD. She is also an award-winning clinician and researcher. Today she is here to guide us on understanding the real cause of hair loss and how to store hair health naturally and, most important, permanently. So without taking much time, please join me in giving a warm welcome to Dr. Sindhura ma'am. Over to you, ma'am.
Thank you so much for that introduction. So basically, I think one thing I'd like to clarify is nothing is permanent. So let me just put that forward first. Today I'll be discussing about how to take care of your hair when it's normal, when it's falling, and when you have scalp issues. And in general, what is a good hair care routine. So basically, but then if somebody is having issues with the hair and the root cause keeps repeating, then you might have to again take all the treatments. So probably I think permanent is not a word that I would like to use here. So let's jump into the PPT. So basically, I will first deal with the most common questions that my patients ask me as to like how to regularly take care of their hair, and then I'll go and I'll talk about how to deal with hair loss in men, women separately. So now people ask me whether to oil their hair, whether not to oil, what kind of oil, when to oil. So basically, oiling, I would usually suggest a pure 100% virgin coconut oil. And it is best done about 15 to 30 minutes prior to the hair wash. Best done on the hair strands, not much on the scalp. And especially if you have a very oily, greasy, or dandruff prone scalp, then I would avoid oiling the scalp. And then also if you have a lot of acne on your forehead or on the sides of the cheeks, then also avoid applying oil. If you apply oil on the hair also, always tie it back instead of leaving it open so that the oil doesn't touch the face and cause more acne. And many people ask which oil helps with hair regrowth or stopping hair fall. I mean, there is no proven this thing or proven studies that but oils help with reducing hair loss. The only thing oil does is to help condition the hair strands and to help seal the cuticles. Apart from that, there's no proven thing that oils help increase hair growth or reduce hair loss. Rosemary, yes, has a bit of evidence, but you can add rosemary oil like a drop or so in a little bit of coconut oil, apply it about 15 to 30 minutes before hair wash, and then wash it off. So after oiling, basically within half an hour, you'll have to use a shampoo to cleanse. Depending on the type of your hair and the ideal frequency of hair wash, if you're a person who works out regularly or who sweats a lot, even everyday wash is also okay, especially during the summers. Otherwise, 2 to 3 times a day, 2 to 3 times a week, based on how much you're exposed to outdoor dust, how much you sweat, whether you have a very oily, dandruff-prone scalp, or whether you have a very dry and sensitive scalp. If the scalp is very dry and sensitive, then probably once or twice a week. If you have very oily, dandruff-prone scalp, then every alternate day. And depending on your scalp condition, you can choose a shampoo. If you have a lot of dandruff or greasiness or oiliness, then sulfate-free shampoos will not work for you. So you have to go for a proper, depending on the condition, a medicated shampoo or a shampoo which properly removes all the grease and the dirt. And if you have a a very dry and sensitive scalp, then use mild baby shampoos or you can use sulfate-free shampoos. And if you use a very mild shampoo and your hair is usually soft and straight, even if you skip conditioner, it's fine. If you have frizzy hair, that's when you can use conditioner. Any conditioner is okay, nothing in particular, but you will have to use it at least 3 inches away from the roots so that the conditioner does not stick onto the scalp and cause more dandruff. And after conditioning, you can use a leave-on serum, again based on the hair texture. Just make sure even the serum is not applied very close to the scalp. And after washing, make sure that you immediately dry your hair either with towel or air drying, or even with a good hair dryer in the cool to lukewarm setting from a distance. Just make sure you're not excessively heating your hair while drying. Now, coming to styling. So, basically, every time you take a hair wash, if you're using a hair dryer, make sure that you're not using the extremely hot setting. Make sure you use a heat protectant before you do. And make sure you are doing it from above to below and not just randomly. And when you're drying your hair, also, just make sure that the setting is in the cold to very low heat setting rather than high heat setting, except maybe occasionally you want to style your hair. And maybe you can use heating devices like straightening or curling or something once a week maximum. If it's less than that, then that's even better. And always use a heat protecting serum, and avoid using excessive heat on already chemically treated hair, because that will damage the hair even further. So again, hair color basically is something now these days, even 20-year-olds, 30-year-olds are also having a lot of gray hair, because of which many of you want to use some form of hair color. Ideally, it's always better to use hair colors which are free of ammonia and PPD. So paraphenylene diamine, PPD, is a chemical that actually easily causes blackening of the hair when the dye is used. But with PPD, the problem is it is a very important allergen, as in that leads to allergies on the scalp, allergies on the face, pigmentation of the face, and sometimes rashes on the back. So, if you want to choose a hair color, choose something which is both ammonia free and PPD free. But if at all you're using a regular hair dye and you're okay with it, you have no issues like pigmentation, like itching, ear itching, scalp itching, then you can still continue to use it, but do not use it for more than once a month. The least frequency is always the best, because lesser chemical exposure would be there. And also, if you in case develop any sort of rashes or itching post application of hair dye, then it's always better to ask your dermatologist. Now, again, chemical treatments are something that is being done very, very frequently and commonly. But frequent chemical treatments, frequent heating using a formaldehyde based treatments like keratin and all, that can lead to damage of your cuticle. It can reduce the strength of your hair. It leads to breaking of the hair, and of course hair fall. A lot of people who do keratin treatment or Botox and everything do come with some form of hair loss within a month. And also, some of these treatments like keratin, which release formaldehyde, if you're very frequently doing it and you're exposed to the fumes of formaldehyde, it is also known to be a cancer causing agent. So, definitely do it as little as possible. And among the straightening treatments or the smoothing treatments, cysteine treatment is relatively okay, but make sure that you're not doing it very often. And if you have colored hair, try to avoid other chemical treatments. So basically, combination of chemical treatments shouldn't be overlapped as much as possible. Now, coming to the most common problem that many people come to me with, which is hair fall, of course, which is common both in men and women. So most common causes include genetic, especially in men. Seasonal loss, especially in during this season, a lot of people are having more hair loss in the past 2 to 4 weeks once the season has shifted from monsoon to winter. And of course, excessive dandruff and scalp itching can also cause some hair loss. In women, the most common cause of hair loss is nutritional deficiencies and hormonal imbalance, especially iron, vitamin D, vitamin B12, PCOD, thyroid disorders. All of them can lead to excessive hair loss in women, especially. And stress, of course, is a common factor for both men and women, because both of them, I mean, with the current lifestyle that we have, stress leads to a lot of hair loss. And the lesser common cause would be using harsh hair products. So, coming to basically, okay, let me just elaborate a little bit more about the causes. So, basically, suppose you're a person who's experiencing hair loss, you'll basically have to evaluate a few things by yourself. One being, off late in the past 2 3 months, did you suddenly have an increase in amount of stress, a reduction in the amount of sleep that you have, a shift in your diet in terms of either sudden weight loss or sudden weight gain, and in terms of if you had any recent fevers, either it could be severe fevers like dengue, COVID, typhoid. All of these things can cause sudden excessive hair loss. If somebody is facing this sudden loss, like more than 100 200 strands a day, that means something in the recent past has shifted, and that led to reduced hair strength, and that is called telogen effluvium. Whereas in some people, basically, it could be a long-standing thing. Like people come to me saying, I've been losing hair since the past 4 to 5 years, or even more than that. And almost every day, 100 or more than 100 hairs I usually lose. Then, in that case, we have to think about hormonal disorders, nutritional deficiencies, and of course, chronic stress in some people can also cause this kind of excessive hair loss, which is a more continuous phenomenon. So food is definitely one of the most important thing that helps with strengthening your hair, and that is also one of the most important advice that I give my patients when it comes to hair loss. So you should obviously have plenty of water, minimum 3 liters per day. Your food has to be protein rich. So if you're a non-vegetarian, then basically have eggs, chicken, fish, at least 3 to 4 times a week, eggs every day, and supplement with vegetarian protein as well in between. For vegetarians, getting a protein rich diet is a little tough. In that case, you can always supplement it with some plant-based vegan protein powders. But make sure that every meal has some form of protein in it rather than just eating a lot of carbohydrates. And people with iron deficiency should make sure that they eat a lot of iron rich food like leafy vegetables, organ meat, and overall, basically, vegetable rich diet. And along with that, the food that we eat should have a lot of antioxidants. So anything brightly colored like pomegranates, blueberries, carrots, any rich yellow colored fruits and vegetables, all are rich in antioxidants. So that basically helps with improving the strength and texture of your hair, because that reduces the stress induced damage that happens to the hair follicles. And then comes fiber rich diet, which helps with your overall metabolism. So whenever you're eating something, make sure it's a whole food. So that means if you're eating rice, make sure it's either brown rice or red rice instead of fully polished white rice. If you want to choose a carb, make sure it's a whole carb. Like suppose if you want to eat chickpeas, eat them boiled rather than making them into a complete paste and all of that. Now, coming to avoiding foods, so basically anything that is rich in sugar, rich in unhealthy oils, and rich in garam masala can cause inflammation in the body. And if you are consuming these foods on a very regular basis, then that can lead to increased inflammation in the body, on the scalp, and lead to hair loss. So try to keep your sugar and junk intake as minimal as possible. Definitely not more than once a week. So I think brushed upon some basic issues and some basic causes. So over and above this, each person has their own profile as to why hair loss is being there, as to why hair loss is happening in them. Maybe it's genetic, maybe it's some deficiency. So whenever you have hair loss, most important thing is to consult a board certified dermatologist rather than just go to any random salon or clinic and just because most of the times what happens is when you walk into any particular place which says that they deal with hair disorders, they have trichologists, just check their degree, because usually anybody who has a degree of MD dermatology, DTVL, which is diploma in dermatology, or DNB dermatology, only these people are certified to treat hair and scalp disorders. Anybody who claims themselves to be a trichologist usually does not have these degrees, and most of the times what they do is just do a lot of unnecessary PRP treatments, some form of treatments which ultimately do not give you great response because your root cause is not being treated. And finally, you again end up going to a proper dermatologist, or you end up losing hope. So always when you are about to consult a dermatologist, make sure that they are properly board certified. Okay, so I hope I have given some basic idea about hair loss. We can take some questions if we have time. Okay, so the first question is by Rajneesh Thakur. He says, I'm experiencing location specific hair loss. I'm from Bihar. No hair loss there. It starts as soon as I stay in Bangalore or Hyderabad. Okay, so basically, yes, location specific hair loss can happen because of either the change in water, change in weather and environment, and also your change in diet, because at home you might be eating a little more healthier compared to what you're eating here. Maybe if you're not living with family, you might be eating a little more food outside. And also, water in Hyderabad is pretty hard. So make sure you're using a water softener or you can use mineral water to wash your hair. Okay. Any possibility of shampoo and conditioner use affecting quality of hair? Yes, if you're a person who shampoos very regularly, like every day or every alternate day, and you're using very harsh shampoos, then it can affect the quality of hair. So try to, if you depending on your frequency of hair wash, try to use something more appropriate. After hair wash, my scalp is becoming more dry. So, probable reason is either you're using a very harsh shampoo which does not suit your scalp. If you have itchy, sensitive scalp, then make sure that you use a milder baby shampoo or a sulfate-free shampoo for your scalp wash. I have heard washing hair with hot water can cause hair fall. Hot water, if it's too hot, then yes, it can sort of damage your follicles. So, lukewarm to cool water is what I would usually advise. Nothing very hot. How to reduce hair fall due to thyroid? Okay, so basically, thyroid, especially if you have autoimmune thyroid, which is Hashimoto's, then even if your TSH level comes to normal, still your hair loss will continue because the inflammation in the body is not reducing. So you will also have to follow a proper anti-inflammatory diet, which is rich in protein, to help reduce hair fall due to thyroid. When someone has food allergy induced dandruff, what's the best course of action in terms of hair care? Okay. So basically, there is nothing called food allergy induced dandruff. Most likely, if you're eating unhealthy, yes, that can lead to dandruff. If you're taking a lot of dairy products, a lot of sugars, yes, it can lead to dandruff. So try to reduce those things, or probably don't have it more than once or twice a month. What can a male with short hair and good diet do to cure dandruff and hair loss? Okay, then we'll have to look for other causes, and also if you have a genetic predisposition towards balding and hair loss, then that needs to be treated. How to apply oil and which oil? I think I've covered it in the PPT. Basically, coconut oil 30 minutes before hair wash. Does minoxidil have side effects? So, topical minoxidil, if applied properly, usually does not have side effects, but sometimes the alcohol content in the minoxidil solution can lead to a little bit of itching and dryness. Rarely, minoxidil can cause some form of allergies like itching and rashes. If that is the case, then that means it doesn't suit you. So then don't use it. But otherwise, if it suits you, then using it long term also does not have any issues. And this is for topical minoxidil. If you're talking about minoxidil tablets, then I usually don't give them. So, facing severe postpartum hair loss. So, for Mansi Joshi, severe postpartum hair loss since a year means it is lasting more than it should. That means you'll have to get your iron and vitamin D and thyroid, all three of them checked. Okay. After hair wash and conditioning, my scalp is becoming dry. How to maintain hydrated? We'll have to check if it's just dry scalp or if you're having some form of dermatitis which is aggravating after the hair fall. So if it's itchy, I think it's better to once consult and see if you have any particular scalp condition. Otherwise, try using a milder shampoo. How to get rid of greasy hair? Wash every time whenever we want to go out. Okay, greasy hair. If you have genetically prone to oily and greasy scalp, then unfortunately nothing much we can do. This is a call announcement. Code study ER Code study ER Code study ER. So basically, if the greasiness is genetic and you have a very oily scalp, then nothing much we can do but to wash regularly. Sometimes there are some medications like isotretinoin which help with reducing the oiliness, but this we give only if the issue is too much that the person on the same day within a few hours of wash, if it's getting greasy, that's when we use the medication. Otherwise, we don't. Can you recommend best shampoo for scalp? Okay, so it depends on the type of scalp. If it's dry, sensitive, dandruff prone, based on that only I can recommend. And how can we reduce hair graying? So, gray hair, especially below 30 years of age, can be related to either nutritional deficiencies, especially zinc, B12, and iron, or it can be related to stress, or it can be related to smoking. So you'll have to look at all of these things and see what exactly is causing your hair graying. Also, when we treat these conditions, gray hair that is already there may not revert back completely to normal. We can only stop new hair from turning gray. Can using soap nut reduce hair loss? Definitely no. Is hair regrowth possible after age of 30? After age of 60 also hair regrowth is possible. Depending on your follicles, of course. When we start early, definitely hair regrowth is possible. Drastic hair loss in last 6 months. How to control such sudden increased hair fall? So you will need to check for vitamin deficiencies and thyroid if the hair fall is drastic for so long. I'm suffering from hair loss and gray hair. Could you please suggest any products? So all of these Instagram marketed products which say they turn gray to black, 90% of them don't work. We only have to look at what is actually causing your graying. Is it stress, nutrient deficiencies, lack of sleep, and then correct that factor? Only then little bit of improvement will be there. What tests are needed to detect? Okay, so basically a lot of these labs these days have hair fall packages where they test for your hemoglobin, vitamin D, B12, thyroid, sugars, and ferritin levels. So these are the basic tests. Olaplex helpful for hair growth? No. Maybe for softening, but not hair growth. What could be done for frizz reduction and to get shine? So if it's extremely frizzy, you'll need to check for iron deficiency, add some biotin supplements, eat a protein-rich diet, and use an appropriate shampoo. What do you think about Traya? It's probably not best that I say this on an open forum.
Hi. Actually, twice in a week I'm washing my hair, but
Okay.
still I'm using that aloe vera shampoo.
Okay.
Still I got a white flash every day after washing the day. After, I'm getting a kind of wash flash.
I didn't get
Then
you.
dandruff
So you're
flags.
having dandruff in spite of washing your hair regularly, right?
Yes, yes, yes.
Okay. So in that case, you'll have to use a proper anti-dandruff shampoo, not aloe vera shampoo.
No, I discovered that aloe vera means Ayurvedic doctor I consulted. They suggest me that aloe vera shampoo.
Yeah,
Still
but
after
it's
that,
not working, right? If it's not working, go to a proper anti-dandruff shampoo.
can you suggest me any dandruff? My hair is a kind of it's
You
a
can
dry.
use any ketoconazole based shampoo.
What is it?
Ketoconazole. So basically, it's better not to take brand names, ideally. So in the market, there are a lot of ketoconazole based shampoos available. You can take that.
Okay, okay. Any serum can you suggest me
For
for hair growth? That it is
again,
all.
you can try minoxidil if you're having any balding, but otherwise, it depends on what is causing the hair loss.
Okay, I'm not facing any hair loss, but it is I'm facing too much dandruff. That is a major problem.
For the
Every
dandruff, you need to use a ketoconazole shampoo.
okay, okay. Is there any specific in that ketogenic?
That's I am not supposed to take brand names.
Okay, fine. Thank you so much.
Okay. Hello. Tell me.
Yeah, hi, madam. So myself, Rajneesh. Actually, my big brother is also facing same issue. He is in BHEL Hyderabad, and now I am in Bangalore. So our main problem is water only. I sent a message also. So my age is like 26, 27 only, and every day losing hair. So can you recommend me anything so I can control my hair and regrowth? Is it possible?
So basically, if the water is the main cause, first you'll have to make sure you're using a water softener on your tap or you're using mineral water for a couple of weeks.
Also, I tried all the things, but nothing happened, madam, honestly. And I don't, in my family member, don't have any genetic issue as well.
Once check yourself for vitamin D or B12 deficiency.
Mhm.
And if you do have deficiencies, make sure you're treating them. And if you are in like night shifts or maybe you're a late sleeper, try to avoid that also.
No, I don't have anything. No, even I never smoke. My brother never smoke. Due to we realize only ki water issue is there, but we start. we started using Bisleri one and Drink Prime we shifted in, but it's still losing.
How long did you try that for?
6 months.
You've been washing your hair for 6 months with Bisleri.
Yes.
Okay, then you need to check your scalp with a local
देन तो
dermatologist.
आई डिसाइड कि मतलब भाई अपने होम टाउन चले जाओ एंड
हम्म,
हाँ.
आपको होम टाउन में नहीं होता है?
नहीं, नेवर नेवर, मतलब ये ऑनेस्टली आई एम टेलिंग यू, यू आर अ डॉक्टर राइट, बट आई
हम्म,
एम गिविंग यू अ मतलब बेस्ट एक कॉज कारण कि मेरे होम टाउन में नहीं होता है. हम लोग मतलब कभी एक कुछ भी नहीं खाते वाते, जिम जाता हूँ, फ्रूट्स ड्राई फ्रूट्स, आर कल्चर ऑफिस कल्चर इज ऑल्सो गुड, बट
वे प्रोटीन लेते हैं?
वे प्रोटीन नहीं लेता हूँ मैम.
नहीं लेते हैं?
नहीं.
Okay, so one more cause of hair fall is either whey protein or excessive dairy related protein. अगर आप regularly पनीर खाते हो या बहुत ज़्यादा दूध लेते हो, वो भी hair fall cause कर सकता है.
तो अभी हमें प्लीज आप सजेस्ट करो मतलब बिफोर मैरिंग आई डोंट वांट टू लूज एवरी हेयर, 60-70% लूज हो गया. इफ यू मतलब मैं हैदराबाद आता हूँ तो आई आई विल ऑब्वियसली मीट विथ यू. ठीक है, तो रीग्रोथ का एनी प्लान बताओ प्लीज.
वही ना, बिकॉज पहले कारण नहीं पता हेयर फॉल का को तो रीग्रोथ का कैसे पता चलेगा. सो इफ यू डिपेंड्स ऑन योर स्कैल्प, ऑन योर हेयर डेंसिटी एंड योर डाइट. तो थोड़े दिन के लिए आप डाइट में डेयरी और जंक अवॉइड करके देख लेना एंड मेक श्योर कि आप कम से कम 40-50 ग्राम्स ऑफ प्रोटीन पर डे खा रहे हैं along with using soft and water for hair wash.
ठीक है, तो इससे रीग्रोथ हो जाएगा या फिर कंट्रोल होगा?
पहले तो हेयर फॉल कंट्रोल होना चाहिए ना, उसके बाद ही रीग्रोथ आएगा.
वेयर इज योर ऑफिस इन हैदराबाद मैम?
आई एम वर्किंग एट स्टार हॉस्पिटल, नानक रमोला.
ओके, ठीक है. ओके मैडम, थैंक यू, बट ये बहुत
How to identify if the hair loss is genetic or some other reason? That is basically based on the pattern of hair loss that you have, and also if your immediate family members, like your father, mother, grandparents, or aunts and uncles, have balding, then your chance of having it is much more. But if you're, and also pattern, basically if you're a male who's losing hair from the center or the upper part of the scalp and not like overall, then that's more of a genetic pattern. Exposure to cold weather can it lead to hair fall. So basically a transition of weather from monsoon to winter is known to cause hair fall temporarily for about 3 to 4 weeks. How can I naturally regrow hair on a bald spot? And how can I remove dandruff completely? So, dandruff is definitely an ongoing problem. A permanent solution usually depends on multiple factors. But can you naturally regrow hair if the spot is completely bald? Then naturally regrowing is probably not possible. If it's just sparse, then you can try rosemary, you can try eating a protein rich diet and having a stress free life. So I'm using ketoconazole and zinc shampoo 2 times a week, but the flaky skin shedding along with dandruff pops within day two. My scalp sweats when I eat hot or spicy. Okay. Scalp sweating is genetic, so that we can't do anything. But if the skin is still shedding by day two, then you need to check whether there is any inflammation in the scalp, something known as seborrheic dermatitis. If that is there, then that needs to be treated. I had active acne. My dermatologist used isotretinoin. Now my hair is not getting thinner and also facing hair loss. Okay. Isotretinoin can cause hair fall, yes, but it's temporary. Once you stop isotretinoin, go on zinc and biotin supplements and it will help with the hair. And if you have iron deficiency, you have to treat that also. Could you suggest some hair color shampoo brands? For for colored hair, any random brands that are available are okay. If you wash very regularly, try to use little quantity of shampoo, not a lot. I had severe hair fall due to iron B12 vitamin D deficiency. After a few months of supplementation, hair fall has reduced. How do I ensure I can maintain this on a long term basis? Okay. So I think vitamin deficiencies are one of the most important cause, and also once you treat them, hair fall does get better in many people. So for maintenance, basically vitamin D once a month, 60,000 units, B12 twice a week, 1500 mcg methylcobalamin, and if you are a female, right? Huh? So for women, iron supplements at least 2 to 3 times a week. These are for maintenance, and if at all you don't want to be on supplements, vitamin D, though you have to be on a supplement. We have no other choice. But for iron and B12, you can eat weekly once organ meat, which means mutton liver, mutton bone marrow, mutton bone soup, and all of that, and leafy vegetables as regularly as possible to help with the hair, and flax seeds. I have active. Okay, sorry. People
Ma'am, I have allowed a Rafik Islam to speak. So could you please mute yourselves and start your question? Ask your questions with ma'am. Rafik. Okay, Satya, you are now.
Yeah, hello. Hi.
Hi.
My question is like, so I recently migrated to this Bangalore area. I'm facing a lot of hair fall and like skin issues like dryness and itchy things. So I was like, I'm taking all the good food only, like rich in protein, like carbohydrates and this fiber and everything. So I'm already taking this omega 3 and EVR 200 daily basis. So I'm planning to take this supplement called biotin and collagen also. Is that okay to take?
You can take collagen, you can take omega 3 if you're working out regularly.
Hmm.
Biotin, don't overdo it because sometimes taking excessive biotin can interfere with some other things. So, I mean, you can ideally take enough biotin by eating about 3 eggs a day with the yolk,
Okay.
because egg yolk contains biotin, not the white. If
Oh,
you can take like 2 yolks a day, usually you do get some almost enough biotin. You can take whole nuts like almonds, walnuts, and all that also helps.
okay.
You can limit your biotin supplementation to once or twice a week.
Okay. And how I'm taking is like this 5 working days I'm taking. This weekends I'm not taking it because taking continuous supplement also costs something. So I'm afraid of that. So 5 days I'm taking, 2 days I'm leaving that
That you can
supplements.
do, but I think biotin even for 5 days it's not required if you're eating properly. Yeah.
Nikhil, now you can unmute yourself and ask question with ma'am.
या मैम गुड इवनिंग मैम
Good evening.
मैम एक्चुअली कंसर्न कैसा था कि मतलब बेसिकली हम लोग अभी बेंगलोर में रहते ठीक है तो फिर बेंगलोर का पानी का कैसा है कि मतलब रिगार्डिंग बोर वाटर प्रेफर करते हैं यहाँ पे तो फिर मैं क्या करता हूँ कि बाल के लिए धोने के लिए फिल्टर वाटर प्रेफर करते हैं और उससे बाल ऐसा कुछ मतलब ज़्यादा गिरते नहीं और सेकंड मैम मेरा बोलने का मतलब ये था कि मैम अगर वॉश करने के बाद हम लोग तेल लगा सकते हैं क्या बाल को
नहीं, वॉश करने के बाद मत लगाना, करने से पहले लगाना।
पहले से एक्चुअली में प्रॉब्लम क्या है अभी बचपन से वो तेल डाल के आदत है तो फिर स्कूल डेज से वैसे चल रहा है तो पता है स्कूल में कैसा था तो फिर अभी क्या होता है कि बिना तेल लगाए तो ना मैं बाल ना बहुत फिजी हो जाते हैं तो फिर उसके लिए आप क्या सजेस्ट करें सीरम लगाए तो भी वो ज़्यादा देर टिकता नहीं तो फिर एक ऑप्शन बचता है कि कोकोनट ऑयल उसके कितना भी प्रोडक्ट्स भी ट्राई कर लो वो कुछ काम के नहीं रहते तो फिर वो एड्स और आते हैं तो फिर बेसिकली तेल ही यूज़ करता हूँ मैं मगर वैसे तो ठीक ठाक ही है बाल मगर क्या होता है थोड़ा स्ट्रेस की वजह से
अगर
बाल हाँ
आपको डैंड्रफ की इश्यू नहीं है और ग्रीजी स्कैल्प की इश्यू नहीं है तो थोड़ा सा कोकोनट ऑयल आप ऊपर ऊपर लगा सकते हैं, देयर इज नो प्रॉब्लम, बट
ओके
डोंट एक्सपोज योरसेल्फ टू टू मच पोल्यूशन रेगुलरली व्हेन यू हैव ऑयल अप्लाइड।
मैम डेली मतलब सोप मतलब सोप कौन सा करता है वो ये बायोटिक का जो है वही यूज़ करते हैं नॉर्मली ऐसे बेसिकली ज़्यादा वाला कुछ यूज़ नहीं करते तो फिर उससे भी अच्छा खासा झाग भी आता है और ठीक ठाक ही रहता है मगर मैम और एक था एक्चुअली हम एलोवेरा जेल लगा सकते हैं क्या बालों के लिए
एज अ स्टाइलिंग एजेंट,
स्टाइलिंग करके नहीं है जस्ट थोड़ा बहुत मतलब ठीक ठाक मतलब ज़्यादा बाल ना वो ठीक से मतलब हवा में पूरा बिखर जाते हैं
जी हेयर फॉल के लिए तो एलोवेरा काम नहीं करता है, बट
हाँ
हेयर
हाँ
सॉफ्टनिंग के लिए ठीक ही है।
ठीक
एंड
है
वो
ना
भी प्रेफरेबली डायरेक्ट प्लांट से लेके थोड़ी देर लगा के वॉश कर लेना।
नहीं वैसा वाला नहीं, ये रेडीमेड वाला ही बात कर रहा हूँ मैं।
अच्छा,
वो सब
रेडीमेड
कौन
वाला
करेगा
तो
भाई?
थोड़ा सा तो आप कर सकते हैं।
चलेगा ना मैम?
हाँ,
ठीक है
बट देन
मैम।
मोस्ट ऑफ द रेडीमेड वाले में तो मतलब ज्यादा भर भर के नहीं लगाना।
नहीं वो कोरियर वाला आता है ना, कुछ बोलते हैं कि मतलब कुछ केमिकल नहीं रहता है, ऐसा वैसा करके।
तो वही थोड़ा सा बस कैप को ज्यादा टच नहीं करना है।
ओके मैम, ओके। बाद में वॉश करने का नेक्स्ट डे,
हम्म
मतलब बाद में
हम्म
रात में वॉश कर देने का।
हम्म
तो मैं डेली वॉश करता हूँ बाल, तो फिर कुछ
एज
प्रॉब्लम नहीं है।
लॉन्ग एज इट्स नॉट कॉजिंग मोर फ्रिजीनेस और हेयर लॉस आप कर सकते हैं।
ठीक है मैम, ठीक है।
Okay, we can continue.
Okay.
Yeah.
People with thick curly hair often experience more dandruff, which can lead to hair fall. Please suggest a solution. Okay. So the reason could be just because thick curly hair में थोड़ा हवा जाने का the aeration is not that much, and your scalp is usually mostly, if you sweat a lot or if you have oily scalp, it stays back rather than, with the evaporation and all, it doesn't go away, because of which dandruff experience is a little more. So for that, basically you will have to just wash weekly twice at least, and make sure that you're eating right to maintain the scalp. Does Induleka hair oil help with hair loss? I don't think so. I get many patients who use this and say, Doctor, we didn't get any response. So yeah, I don't think so. I'm using ketoconazole 2%, but then also dandruff does not control and lots of hair fall. So with ketoconazole, if it's not controlling at all, then you'll have to diagnose the condition first, whether it's dandruff or seborrheic dermatitis, or sometimes even psoriasis also. So if it's too thick flakes which are very itchy or irritating, then it's better once you consult with the dermatologist and see if you have any other condition except apart from dandruff. After using iron and calcium tablets on daily basis, I'm having postpartum hair loss for 1 year. Okay, so for 1 year, if you've taken iron and calcium and still the hair fall didn't improve, once check your thyroid and start with vitamin D supplements. 60,000 units once a week. Any natural hair mask we can prepare for conditioning. Okay. Natural hair mask, you can use fresh aloe vera, you can use curd. Yeah, these. I tried multiple times vitamin and minoxidil and my hair regrowth, but when after 4 5 months it starts to fall again. Yes, if you are genetically prone to balding, then this is a lifelong treatment. Unfortunately, you have to accept that fact and make sure that you are using your minoxidil regularly and the supplements based on how your doctor suggests it. Can you tell me if it's better to comb hair every day if you have wavy to curly and frizzy hair? It's always better to comb regularly. Otherwise, if you are having like little hair loss and all, that will lead to knotting of the hair, which leads to more friction. So just gentle combing is always better every day once. Could you please provide advice on how to prevent gray hair from spreading? So gray hair, like I already suggested, we should see the cause and based on that treat the cause so that it doesn't spread. I'm using ketoconazole. Okay. I had active. Okay, that is also done. सो इफ क्या विमेन वे प्रोटीन ले सकते हैं और कितना लेना चाहिए? मैं तो वे प्रोटीन किसी को भी सजेस्ट नहीं करूँगी, बिकॉज वे प्रोटीन से काफ़ी लोगों को इन्फ्लेमेशन होता है, डैंड्रफ बढ़ता है एंड हेयर फॉल भी बढ़ता है, स्पेशली इफ समबडी हैज़ अ बॉल्डिंग टेंडेंसी, देन डू नॉट टेक वे प्रोटीन. I tried multiple times vitamin med. Okay, yeah, okay. Should we apply minoxidil lifelong or can it be stopped? If you have a tendency of balding and it's genetic, then yes, you have to apply it until the time you want hair. There is no stopping it.
Ma'am, we have one question from Tanveer. I tried multiple times vitamin, medicine, and minoxidil, and my hair growth. But when after 4 to 5 months, it again
I
start hair
already
fall.
answered this.
Yeah.
Hi ma'am, please clarify if length of hair has anything to do with hair fall. I have experienced that if length is more, okay. So when length is more, we tend to comb a little longer, because of which the pressure on the roots increases. And when the roots are weak and when your length is more, the hair fall will be more. Also, because the length is more, the volume of hair that you see is also more. So if your roots are strong, length doesn't matter. But if your roots are weak, which could be because of any cause like vitamin deficiencies or stress, then yes, length, if it's shorter, it makes it easier. I have dandruff. Can I apply oil before hair wash? Yes, you can, but only on the strands, not massaging on the scalp. Are sulfate-free shampoos better? So basically, for a regular use, if you're someone who washes your scalp regularly, you don't have an oily or greasy scalp, then yes, sulfate-free shampoos are better. But if you have a lot of dandruff or greasy scalp, then sulfate-free shampoos will not work for you. After delivery, I got severe hair fall even after using Indulekha shampoo. Okay, so basically, post delivery hair loss, no shampoos and no hair oils will help. Only thing is, continue using iron and calcium supplements regularly. Take vitamin D at least once or twice a month. Eat a protein rich diet, lots of eggs, fish, all the pulses, dals, and all. And leafy vegetables regularly. Usually, with these supplements, things will improve over a span of 1 to 2 months. Do we need to wash our hair every time before applying minoxidil? No. I usually suggest people to apply minoxidil 1 hour before bedtime. And if your scalp gets greasy, then wash it next morning. You need not wash it before applying minoxidil. Which food will help in hair regrowth? So I think I covered it in the slide. More protein, more antioxidants. For antioxidants, lots of fresh fruits and vegetables, which are brightly colored and not too sweet. And almonds and walnuts, flax seeds and chia seeds. Hope queries. Okay. I'm having hair loss and I also have some sores on my scalp because of which my head is paining a lot. Okay, so that means you have folliculitis, which is infection of the hair follicles. You might need to see a dermatologist to see if you require an antibiotic course and how to take care of it further. Do we have to change soap for skin based on the season? If you have dry skin, then throughout the year you can use any mild pH balanced soap, uh, or a baby soap. But if you have like normal to oily skin, then yes, in winter use a milder soap and in summer use a regular soap. Love Beauty Planet shampoo is good. If you don't have oily or greasy scalp, then yes, it is good. You can use it. Minoxidil need to massage or just apply and mix it. So very gentle massage for 10 to 20 seconds at each place where you're applying it. No harsh massaging. I think we're done with the questions.
If you have any questions, please raise your hand. I will allow you to speak, or you can also write into the chat section. Okay, Rajnish, it's
How to use camphor and rosemary oil effectively. Camphor, I usually do not suggest. Rosemary oil, you can add 1 to 2 drops and a little bit of coconut oil, apply it on the scalp, leave it on for 15 to 30 minutes and wash it off.
Hi, madam. Actually, I'm planning to buy Traya course. Are you suggesting it?
Again, I'm not sure if I can say that or not, but
Traya, right?
sorry.
You heard Traya?
Yeah, I know Traya, but I don't know if I can say yes or no to that. But ideally, people do come to me after trying everything from Traya to Thrive and all of that, and when it doesn't work. Also, I
Hmm.
have seen them giving some medication, which ideally even I would not give, because it can have side effects and
Got
also
it.
don't monitor. So,
Actually, you told in this meeting for dairy product, hair fall is increasing after if you will anybody is consume hair more dairy product.
correct.
So I read this thing. Dairy product is helping to boost our immunity and boost our
In the Traya thing,
no, no. अपार्ट फ्रॉम ट्राई, आपने जो बताया ना कि मतलब
वही वो सी, पता नहीं आपने गूगल पे क्या पढ़ा है, बट देन वो
गूगल पे नहीं, मतलब किसी का रिसर्च पर आता कि डेयरी प्रोडक्ट खाने से मतलब कंट्रोल रहता है और अच्छा है बॉडी को के लिए। आपने बताया डेयरी प्रोडक्ट इज नॉट गुड।
अब वो रिसर्च पता नहीं कहीं यूरोपियन कंट्री से होगा, इंडिया में तो डेयरी प्रोडक्ट अच्छा नहीं है बिकॉज ऑफ द वे दे आर बीइंग प्रोड्यूस्ड।
अच्छा, एंड अगेन यू टोल्ड मी बिफोर कि प्रोटीन का कंज्यूम आप मतलब प्रोटीन सेक लो, बट आपने बताया कि प्रोटीन लेने से ये
वे
डैंड्रफ बढ़ जाता है।
प्रोटीन, वे प्रोटीन से, नॉट ऑल प्रोटीन।
अच्छा, वे प्रोटीन। सो मेरे कंडीशन में कैसा है कि स्कैल्प में डैंड्रफ कम ही नहीं हो रहा है। इवन आपने जो वो केटा वाला 2% वाला मैं यूज कर रहा हूँ शैम्पू, इट्स नेवर वर्क। तो मतलब क्या करना चाहिए?
वही, अगर आपका स्कैल्प बहुत ग्रीजी एंड थिक स्केल्स आते हैं तो हो सकता है आपको सेबोरिक डर्मेटाइटिस करके एक कंडीशन हो, एंड अगर वो कंडीशन हो तो उसके लिए कुछ स्पेसिफिक मेडिकेशन भी यूज करना पड़ता है। बट ऑल्सो लाइक इफ यू टेक अ लॉट ऑफ डेयरी प्रोडक्ट्स, मे बी stop it for a month and see. I have really oily scalp, gets flat in one day. I'm using Schwarzkopf Rescue Repair as my shampoo. If I don't wash it within 2 days, very, very itchy. Okay, so that I think you do have a little bit of heavy dandruff, and heavy dandruff as in little bit of fungal infection is what I can see from this. So try to use an antifungal shampoo like ketoconazole based shampoo on the scalp whenever you wash your hair, not on the entire hair, but just on the scalp. Wash it off and then use your Schwarzkopf shampoo. That might help in reducing the itchiness and flakiness. Also, drink more water. Okay. Instead of using minoxidil, can I use Wishcare hair growth serum or plum? Onion hair growth oil, I really don't know. I don't know if it works. Some people do say it works, but then I see more people who say it did not work. Science wise, I'm not sure if it helps in general. The Wishcare hair growth serum can help if you have some basic hair loss, like a seasonal hair loss, or like some minor hair loss less than 50 hairs a day. But if you're having major hair loss, then first evaluate the cause. First, see why you're having the hair loss instead of just using only serums to help. Serums are always only things that are additional, they are not the main treatment. First, we have to find the cause, treat it, and then only add serums based on that. Is there any way to stop genetic hair loss? So, we can control it, but once you stop the medication, it would go back where you were. So, it's always better to decide that you're going to continue the treatment for a very long time and then only consult, and then from there you can control the hair loss and even get to the regrowth point also. Can we use almond oil or castor oil alternately 2 times a week? You can use them if you don't have a lot of dandruff or oily scalp, and just apply it on the hair, leave it for 30 minutes and wash it off. Like I said, castor oil is going to be really greasy, so make sure you're using a strong shampoo to wash it off. Otherwise, just avoid applying castor oil on your hair. What is the side effect of PRP? If it's done by the right qualified person properly, there is no side effect and in fact only positive benefits. For women, post delivery, which vitamin and supplements? So, always continue your iron and calcium at least 1 to 2 months after you stop feeding. Vitamin D at least once or twice a month, and regular protein rich diet. Does permanent hair straightening cause hair loss? Yes, it can. From purity perspective of coconut oil, which brand would you recommend? Just go to the supermarket, look at the ingredients. As long as the ingredients say 100% coconut oil, you can take it. If genetic hair loss, does hair transplant work? It works, but even after that, you will have to maintain by using minoxidil and the vitamins. And you always have to get it done by a proper certified person, not just any random person.
Okay, thank you so much, ma'am, for the clear, practical, and reassuring guidance you share with us today. And a big thank you to all of our participants for joining in and engaging so well. Let's continue to take steps toward the better well-being and secure your hair growth. Wishing you all a wonderful evening and a relaxed weekend ahead. Thank you, everyone.
Thank you.